Well, this Sunday marks World Heart Day, and keeping that in mind, 90% of adults over 20 in the U.S. are at risk for developing heart disease.
That number's too close for comfort, isn't it? To talk about the growing risk, we want to bring in Dr. Wahaj Aman from Memorial Hermann. Welcome. Thank you so much for being here.
Yeah, thank you so much.
That number is insane. What's up with that? Our American diet?
It is staggering and it is sobering. But I want to tell everyone, yes, these are risk factors, and it all starts with obesity, overweight. 73% of Americans are overweight. Half the population has high blood pressure. Many more are pre-diabetic. But it all, at the crux of it, starts with what you just said, your diet.
What are the telltale signs for heart disease?
You know, so first thing I encourage everyone, please go to your primary care doctors and your cardiologist. Get a routine blood panel, right? Check your cholesterol, check yourself for diabetes, and yep, slap that cuff on and see if you have high blood pressure or not. These basic three things, as well as your weight. These are the main risk factors that you need to start looking for. And now, research saying early on in your life, you know, you're turning 18, 21, go and have a checkup. That's why it's so surprising. 90% of the population high risk for heart disease.
Are there some forms of heart disease that are actually reversible? If you make those lifestyle changes, you can make things a lot better?
And this is the crux of what I want to talk about today, you know. So doctors in general have been so quick to like push pills. And you know, we live in 2024. We have the best medicines known to man, and yet we still see like these staggering numbers, you know, of heart disease. So today, all I want to say is the battle starts in the grocery store. It starts with eating good quality vegetables, fruits, good quality protein. We need to start skipping that donut aisle, that bakery aisle, and we need to really hone in on our food. It is reversible. You lose your weight, we have seen time and again patients reversing their diabetes, really getting a better control of their blood pressure. In my clinic, whenever I have to start a medicine, the goal is always, hey, listen, we need to get rid of this medicine 6 months down the line, and this is the only way you can do that is with owning your health.
Any other preventative measures people can take?
So after diet, the biggest one is start moving. Right? We did a great talk a few months ago about just a few thousand steps and how that sort of has a healthy benefit. 4,000 steps a day. That's when you start seeing the benefit. But take it further. Take it up to 10,000 steps, and then when you're getting that step count, start working out. Lift a little bit of weight. And that's, you know, slowly and gradually, life is a marathon. You know, we're not preparing for a movie for in 6 months. You know, this is a lifelong thing. The lifestyle changes take time. Give yourself some kindness, and that's how it's going to happen.
That's a visual. Pick up the weights and not the pill bottles, right? And it makes a huge difference. Dr. Aman, you're so helpful. I love your enthusiasm to make a difference in people's lives. Get them off the prescriptions. Yeah. It's huge. Thanks for your time.
Absolutely,
From
my pleasure.
UT Health and Memorial Hermann.
Thank you so much.
Great to see you as always.